Hello guys, we are in fourth part of this series. First drugs is Glargine, which is long-acting insulin. Glargine work by activating insulin receptor, thus result in reduced circulating glucose. Clinical used in type 1 and type 2 diabetes. Side effects are hypoglycemia, weight gain, lipodystrophy which is rare. Next drug is Tamsulosin. Tamsulosin is a selective alpha-1 antagonist, which causes peripheral vascular smooth muscle relaxation, leading to a decrease in blood pressure, also decrease prostatic and bladder neck contraction, used as treatment of hypertension, also treatment of benign prostatic hypertrophy. Side effects are first dose syncope. First dose of prazosin can lead to severe orthostatic hypotension with resulting syncope, orthostatic hypotension, dizziness, nasal congestion. Next drug is Atenolol. Atenolol is a selective beta-1 receptor antagonist. By blocking the beta-1 receptor, heart rate and contractility are decreased, used in the treatment of hypertension, tachycardias, and coronary artery disease, especially in patients with diabetes. Side effects: mild bronchoconstriction, avoid in asthmatics if possible, bradycardia, impotence, hypotension. Next drug is Potassium. Work by increasing the extracellular concentration of potassium, increases threshold for a cardiac action potential, used for suppresses ectopic pacemakers, especially those associated with digoxin toxicity. Side effects are hyperkalemia, cardiac arrhythmias, paralysis, shock. Next drug is Meloxicam, a non-selective NSAIDs class. Like ibuprofen, it is a slow reversible inhibitor of cyclooxygenase 1 and cyclooxygenase 2. Inhibition of COX-1 and COX-2 reduces the conversion of arachidonic acid to prostaglandin precursors, resulting in decreased prostaglandin synthesis. There are many uses for ibuprofen, including use as an antipyretic, an analgesic, and an anti-inflammatory, including the treatment of rheumatoid arthritis and osteoarthritis. Side effects are GI bleeding, allergic reactions, interstitial nephritis, tinnitus, hepatitis. Next drug is Clopidogrel. This drug irreversibly inhibits the binding of ADP to the platelet P2Y12 receptor, thereby blocking ADP-mediated platelet aggregation. Used to treat acute coronary syndrome along with aspirin, as well as to prevent cerebrovascular ischemic events. Also used in patients undergoing placement of a coronary stent to prevent thrombosis. Side effects are GI upset, bleeding, neutropenia. Next drug is acetylsalicylic acid, also called aspirin. It irreversibly inhibits cyclooxygenase 1 and 2, which are enzymes responsible for converting arachidonic acid to endoperoxides, prostaglandin precursors, thereby decreasing prostaglandin synthesis. There are many uses for aspirin, including use as an antipyretic, an analgesic, an anti-inflammatory agent, and an antiplatelet drug. Side effects: bleeding, especially in GI tract, increased incidence of gastritis or gastric ulcers, allergic reaction, Reye syndrome, sometimes fatal liver failure in children with viral infections, and last is tinnitus. Next drug is Cyclobenzaprine. Cyclobenzaprine acts centrally to depress muscle neuron excitation by an unknown mechanism. Cyclobenzaprine is used to treat muscle spasms. Cyclobenzaprine may also be used for temporomandibular joint pain. Side effects are dry mouth, drowsiness, confusion. Next drug is Hydrochlorothiazide, a class of thiazide diuretics. Hydrochlorothiazide acts by inhibiting the sodium chloride co-transporter in the early distal convoluted tubule, thereby increasing the retention of NaCl and water in the tubular lumen, and resulting in an increased renal loss of water and salt. Used in the treatment of hypertension, heart failure, nephrogenic diabetes insipidus, decreases polyuria, and recurrent kidney calcium stones. Side effects are hypokalemia, hyperglycemia, hyperlipidemia, hyperuricemia, hypercalcemia, metabolic alkalosis, hypersensitivity reactions. Next drug is Glyphozide, from the class of sulfonylureas. Glyphozide work by three mechanisms of action. They 1. Stimulate insulin release from the pancreas through inhibition of a potassium channel on beta cells. 2. Increase insulin action on target tissues by prolonging binding of insulin to target tissue receptors. And 3. Reduce serum glucagon levels through indirect inhibition. Increased insulin level inhibits glucagon secretion. Used for treatment of non-insulin dependent type 2 diabetes. Side effects are hypoglycemia, skin rash, allergic reaction, disulfiram reaction with alcohol.